really, stigma is a phenomenon of culture, right? It abides in culture. Different cultures have different levels of stigma. But health professionals have their own set of problems, and attitudes. And some of those have made it difficult for patients with mental disorders. We're trying to change that. But you should know that there's a culture that exists among health professionals that often creates barriers for people seeking mental disorders. The first step is to admit that, and then to get busy changing it.
For the past year and a half I was experiencing classic symptoms of celiac disease, which is actually can be pretty serious, and it kept getting worse and worse. And I kept going back to the doctor and saying, please listen to me. I know my body, I'm getting sicker and sicker. And they're like, you had this overdose a couple months ago, or a while ago, and you have anxiety, it's probably just an anxious stomach. Finally, a year later, they did a simple blood test for celiacs, and it came back positive. And from there, I've gotten treatment for it, and I've been diagnosed as positive celiacs with the intestinal damage that comes with it. In my opinion, I think the most important thing doctors can do to serve their patients, especially patients who face mental health challenges, is to really listen, is to throw away preconceived notions of what health is supposed to look like, and really take it case by case. Some person who presents with an anxious stomach could just be an anxious stomach, but it also could be something else. And it's your job to be careful and to be thorough and to take the best care you can of other people, because these people are trusting you. They're in a vulnerable position saying, I am sick, I need someone else's help. And it's your responsibility as a person who's entered this profession to help them. And I think the most important thing is to listen and know that things are different for different people. And you have to treat the entire body. You can't just say, this is your mind. You could say, I don't really know what's going on here. It sounds like this, but let's do this and this. Let's try to make sure everything's going right.
The integration of primary care and mental health is doing more to reduce stigma than anything I've seen. It means that people with mental health problems go to the same centers as other people, and in that center, primary care center, the resources are there to deal with the mental health issues. And as health professionals, we have to respond with a high level of concern, and we have to make sure that we're prepared to make a difference in the lives of all of our patients. So we have to make sure that if we don't have the knowledge and the skills, we are connected to a system of care where we can assure that the patients get what they need.